to support every cell in the body, and it gives us this fluid matrix. So it's all about the space. And if you look at a sponge when it's clean and moist, you can move the sponge and it always props back to its natural alignment. When that sponge dries out over time, it twists, it holds dirt, and then you can actually break it and you'll see the dust. So we want our fascia to be fluid and heated, because as we age, fascia becomes brittle and dry. So it literally is the connector and the communication between every cell in the body so that all interactions can occur in synchronicity with themselves. Okay. Does that help to explain that a little better?
Yeah, that helps. And fascia, we have fascia from the top of our head to the bottom of our feet, correct?
Every single cell is innervated by fascia, from bone to teeth to skin, muscle, hair. I did a really interesting interview with Gil Headley, an anatomist, and he's been diving into the world of fascia through cadavers. So as he's continued to go through the layers, he started talking about the Peri Fascia. That's actually the layer that block therapy is working in, because there's fascia that surrounds the muscles and that connects everything. But as you keep diving in, you see that literally fascia exists between and around every single cell in the body. Okay. And that's the Peri Fascia, according to what he shared.
Okay, that's interesting, because I always imagined fascia as being like saran wrap, just like superficially, like right around the, over the muscles, you peel off the skin and there's that sheath.
Yes.
But it goes deeper into the cellular level.
Yes.
Interesting. Okay, that helps a lot. And what is an adhesion? How would you describe that in the fascia?
So an adhesion, if you've ever seen, well, being a Winnipegger, you would have seen this, when you see the frost on the window and you see it starting to move, that's the adhesions. So as we start falling out of alignment, the fascia needs to grip and connect to other parts to create that stability. I call them false walls and false floors. Wrinkles are examples of false walls and false floors in the body. So if we're not perfectly aligned with optimal space around every cell and we start compressing, the fascia has to create stability so we don't tip over. The adhesions create stability, but they also block blood and oxygen flow. They're like beaver dams, essentially.
Okay. And so if somebody's had surgery, if they have scar tissue, then that's definitely a major site for an adhesion.
Yes. And basically, so scar tissue and coming from injury or surgery is a very palpable, easy to see adhesion. But when I was working in my belly and I didn't have any injuries or surgeries, and yet I was very aware of the adhesions, I became aware that it really comes from the chronic collapse of the body over time. So it's not from a insult that happens immediately. It's just from, if you're sitting in front of a computer all day, collapsed in your core, and I'm tipping forward and falling in over to one side, my body has developed adhesions to very slowly, but accumulating magnetically over time to stop me from tipping even further. But gravity keeps driving us. And then the denser we get, it keeps increasing its pace on how fast we get pulled down toward the earth and therefore age.
Right. Okay. Now, before I interrupted you, you were going to talk about the 3 pillars about space in our body.
Yes. So with the process of lying on the tool, and it's actually made of bamboo. So bamboo and bone are similar in density. And what we need to do is we need to release the fascia at the root, at the bone, in order to free the pattern so that we can start to pull the cells back. So the process of working on the tool with the instruction is creating the space. And we stay in each position for a minimum of 3 minutes because we're melting. We can't force or rush melting. We can optimize it, but to stay in a position for 1 minute, that's not enough time. We really need to engage the breath. And then the second pillar is all about pumping blood and oxygen into that newly created space. So if you think of blowing up a balloon fully blown up is nice and round. It almost defies gravity. It almost glows. Take half of the air out of the balloon, it starts to become wrinkled, it accumulates dust in the creases, and it becomes heavy. So over time, if we're not fully oxygenating with every breath, our cells over time start to lose that plumpness and fullness, and we become heavier. And then that in part is what drives that compression, that lack of blood and oxygen flow. So when we begin with block therapy, we always start in the core and the rib cage so that we can release the adhesions that have locked the diaphragm out of correct alignment. So even if we're practicing conscious diaphragmatic breathing from the space that we're starting in, we're not really optimizing the full use of this muscle, because that 2,000 pound per square inch force holding us out of alignment, it's not releasing just with practice of strengthening the muscle. We need to release that fascia from the bone so that we can bring the diaphragm into its full use. And then we can feed the body up to 6 times the oxygen. And it's because of the air coming deeply enough into the lungs where the majority of the alveoli, the receptor sites, are located, so we can absorb more. And in 2014, they did a study that was shared in the medical news that 84% of weight loss comes through proper exhalation. So
Wow.
that took me back to being in my 20s when I was not eating a lot and working out really hard and getting bigger, thinking, how is this possible? But I wasn't breathing. So I was storing. And the harder that I worked, the more toxic I became because my breaths were so shallow. So to really understand this powerful mechanism and how it's really this, it's like turning on your body's furnace, because again, we become cold and brittle as we get older, but we want to become fluid and heated. So the diaphragm is like the body's furnace compared to breathing through the muscles of the upper chest, which is how most people are breathing. And that's more like a space heater. So it's only heating parts of the body and not very well. So when we change that dynamic in our bodies, it's mind-blowing, the differences in our physiology. And Eckhart Tolle shares a beautiful part in The Power of Now, talking about the difference between the diaphragmatic and the chest breather, and how it even impacts the brain waves and how we perceive life in general.
Powerful. So explain to us what exactly is that type of breathing with the diaphragm.
So it's basically the belly breath. So what happens is we've got this beautiful muscle. When we inhale, this plate of muscle moves down. When we exhale, it moves up. And if properly working, all the organs, the heart and the lungs, they're given this continual massage. And then if this muscle's strong, it also becomes the foundation of the rib cage to support everything up the chain. But because most people aren't conscious breathers, this muscle becomes weak and we start to fall in. So now we have this lack of movement here and all this movement up here. And so now we don't have this heating happening in our internal organs and the heart. So they become displaced from the weight of everything on top falling in and become cold from that lack of muscular movement. So now our ability to digest, to eliminate, to keep the space open for the aorta, for the blood flow to travel, leaving the heart, all of these things become compromised because we're literally putting all of the weight of the upper body and we're crashing it down into the core, which also causes the belly to displace outward. So now we end up having not only a stress mess with the organs, but we're also ballooning. And that was what I was observing in my own body when I was, working out so hard. I was literally driving my body to be shorter and wider at a faster pace by my attempts to lose my size that I had accumulated over that period of time.
So how do we do the diaphragmatic breathing? Can you give us an example? And
yeah,
I know you always mention breathing in and out through the nose, and explain why we do that as well.
So simply, if you're lying on your back, and it's good to do this first when you're lying so that we can just have a freer diaphragm than if we're sitting and we've got that weight. Ultimately, when we inhale, we want the belly to become nice and big. And when we exhale, we want to have the belly move in toward the body. So I always refer to it as squeezing the belly small with that exhale. And we don't want the breath to be forced. So just lying on your back, you can feel the movement. You can also just lie on your front and inhale into the floor. So the floor becomes a prop. When we block, the very first position we do with every single class is that belly position. So the block is right on the belly button, and then we lie on it, and then we use that. So the combination of turning on this muscle combined with keeping the block in position as we breathe for a minimum of 3 minutes, it creates more space in through here so we can melt through these adhesions that help to lift that rib cage up. And even using a rolled up towel is really efficient because it becomes nice and dense. So you can just like fold a towel over a few times, roll it up and place it there. And you can get that same sense of decompressing that area and strengthening and connecting to your diaphragm. So it's all about the movement in the belly. Again, most people, if you hold that belly in, and I was a Highland dancer when I was a kid, so I was always told to hold in your stomach. And of course, it's not your stomach, but when you do that, you have no choice but to breathe through here. But again, that's that very stressed breath compared to really bringing it down in through that other mechanism in the belly.
Now, the majority of our listeners are either dealing with or have dealt with breast cancer. When it comes to fascia and the breast health and all the lymphatic nodes, what kind of advice would you have or explanation as to how important that fascia is for that area?
So incredibly important. So when we start to fall in, which everybody does, what's happening is we're getting this internal rotation as well of the arms. And now we're blocking our lymph nodes through here as well. We're not exhaling fully, so we become toxic. So as we start to release the fascia and we really start to engage that powerful breath, we become an incredibly efficient cleaning body. And ultimately, we want to make sure that there's oxygen in the environment because, of course, negative things in the body can't thrive in a properly oxygenated environment. So through that process of releasing those adhesions and pumping blood and oxygen flow into that space, we start to clean out the area and then we start to feed it properly. And then the third pillar is also understanding proper postural foundation so we can continue to support proper alignment. It's if you see a stream that's nice and fast flowing, it's clean. I actually live 13 stories above the river. And every year I get to see it melt and thaw. And it was actually quite fascinating because a number of years ago, there was a tree that had fallen into the river down the stream. So I could see the foam in the center traveling down in that nice wave. And then it got attracted to the underside of that tree that had fallen in. And then it was chaotic. And if you look at how smoke leaves a pipe, it first leaves as a wave, then it starts to circle, then it's chaotic. And that's exactly the pattern of what I could see because here's a barricade. So when we create those barricades in the body, we start accumulating the toxins and the debris that negative things feed on. And when we start to let that go and we start to pump blood and oxygen into that area, it cleans out the food for the bad and it creates room for breath to come in and health to resume. And it's incredible how quickly the body can regenerate and heal when given what it needs. And the first and most important thing is to really connect to that full exhalation so that we can move the past, move the debris out of the body and create that space for health to thrive.
When I use the block on my left upper rib and my deltoid, because the breast cancer was on the left side and I've got scar from using the black salve in my first healing journey, it was incredibly painful. However, I know you say in your videos, smile when you feel the pain and, envision breathing through that pain. And, of course, if it's too intense because you're holding your breath and you back off a little bit. But I could tell as I was breathing through that it really started diminishing. And each time that I did the block in that area, it was so much better. And then I felt so much relief and I didn't realize how tight my shoulders were. So it's really fascinating work.
And that's the nice thing. We really can trust our breath. The rule that we use in teaching people your limits is your breath is your guide. So as you mentioned, as long as you're breathing in a relaxed way, you're feeding and healing. If anything hurts so much that it's taking that relaxed breath away, that's your body saying that's too much, it's too intense, and we need to back off. And that's the beautiful part of this. Initially, people, when they encounter it, what happens is if you give yourself that first minute, and of course you're in control of how much pressure, those pressure fibers start to kick in. they're larger in diameter than the pain fibers. So suddenly that painful experience changes and it becomes what most people call a good pain. And then as you come up and you're like, okay, now I can bring my shoulder back, or now I have a greater range of motion. That's because we've now opened up this clogged space. So then the body sometimes, and notably it should be, going through a healing crisis. I like to call them healing opportunities, because let's say we were collapsed like this for years and suddenly we open it up, there's a whole bunch of debris that's going to be dumping into the bloodstream, potentially coming out through the skin. You might experience a rash, you might experience mucus production, you might even get a fever, because those are all means of your body doing its job to move out the old, even emotional releases, feeling anger, feeling sadness, like whatever got trapped in that fascia is going to be opened up and released. So the body is going to experience it on the way out, but then you're left with a cleaner slate. And then we can keep diving deeper and deeper and deeper. And you see that as you keep going, there's just more and more gifts that come with the process. It's really profound and so simple yet, because it's really just about understanding like the three things. And it's really just, we need to iron out this body that has become crumpled and accumulated dirt. And it's now like a feeding tube for other things that we don't want, but we don't have to allow that. And that full conscious exhalation is really the key to cleaning out the body.
And it's very simple, but it's very profound, because I think in one of your videos you mentioned it almost feels like you're getting into a very meditative state, because you are conscious of your breathing, you're conscious of one area of your body, and it really helps that parasympathetic response to get you into that relaxation response, even though you're feeling some discomfort. That discomfort releases after a minute or two. So,
and I think people also, and I think people also just love the shift in the relationship that you have with pain, because pain simply equals, cells not getting what they want and need. So it's adhesion. So we use pain as our roadmap. So for example, if I have a frozen shoulder and I can only lift it to here, if I start blocking in through that shoulder joint, suddenly I'm releasing the adhesions that have locked me in this alignment, and suddenly I can open it up to here. So with each pass of connecting to pain, again, you gain more freedoms, and that in turn equates to you connecting more deeply with your cells. I love Greg Braden's work. In his book, The God Code, he talks how on the surface of every single one of our cell membranes embedded is the message that God lies within. So we want to be connecting to all of our trillions of cells. And most people are really only aware of what's on the surface. As we start diving through this process and we open up, and then we move deeper and deeper and deeper, we're hearing those messages that we're meant to have so that we can share our gifts with the world. And so it is this very beautiful thing where initially people generally start for a reason. Some start for pain, disease, anti-aging, weight loss, whatever your reason is. But as you keep moving forward through it and you start connecting more deeply to yourself, it becomes this lifestyle, because you continue to gain these incredible benefits, anti-aging being one of them, because really all aging is the accumulation of gravity in the tissue over time, and how we've allowed that to happen. But we don't have to. That full exhalation is the counterforce to gravity. Every action has an equal and opposite reaction. So as gravity is constantly pulling us down, every full exhalation lifts us. But most people aren't exhaling hardly at all. People can take a nice full breath in, but then they, and in the book, The Science of Breath, they talk about the mechanism inside the nostrils. We should be breathing in and out through the nose. Most people think I'll breathe in through the nose, out through the mouth, but that book, and again, it's also yoga philosophy to use nose breathing. And there's an incredible mechanism. There's 3 turbinates on the base of each nostril that distribute air to feed one side of the body and the other, and all these cilia, so that we make sure that we're not inhaling toxins in, and yet we're also keeping hydration in as we exhale. So when we breathe through the mouth, I always equate that to like eating like a chocolate bar for energy, as opposed to a really healthy meal that's going to give you